Hello, this is Dr. Malik. I'm a Texas medical doctor and a Dallas personal injury attorney. Today we're going to talk about Bard IVC filters and the various lawsuits that have been filed against Bard. Bard is the manufacturer of these IVC filters. They make two models. One's called Recovery and one's called a G2. These IVC filters are basically spider-like medical devices which are placed into the leg to prevent a blood clot which is down further in the leg, a deep vein thrombosis, from breaking off and traveling up into the lung and causing a medical condition known as pulmonary embolism. Traditionally, when somebody has a blood clot in the leg, a deep vein thrombosis, it is treated with blood thinners, typically Coumadin. And the reason why doctors may use an IVC filter or an inferior vena cava filter is because there's a problem with long-term therapy with Coumadin. Traditionally, patients have been on this medicine for about a year when they've been diagnosed with a deep vein thrombosis in the leg. Now, the problems that you can have with Coumadin include bleeding. Somebody could be allergic to the medications, and finally, women who are pregnant, for example, Coumadin is contraindicated because it can cause some birth defects. The IVC filters are usually not kept in place indefinitely, and the problem becomes when the IVC filter is left there for some time, it may erode into the wall of the blood vessel and cause problems such as internal bleeding, internal hemorrhage. It can also break through the wall of the inferior vena cava and erode into other neighboring organs and blood vessels, for example, the aorta or into the bowel. Also, the filament is made of metal fragments which can break off. The spider-like filaments, they can break off and travel up into the heart, into the lung, and into the brain and cause further problems. The lawsuits basically claim that Bard knew or should have known that there was a problem with these IVC filters, that they were not designed to be left indefinitely into the body, that there was a risk of these fragments and filaments breaking off and going up into the heart and into the lung and causing problems. There are some trials set for 2014. It's kind of early days in this litigation. We're all hopeful for a satisfactory outcome to this litigation. Well, that's all we have time for here today. This is Dr. Malik signing off. As always, I welcome your thoughts and comments, and you can always reach me at the number listed below. Thank you again.